Hi everyone, welcome back to my channel. In today's video, we'll solve some CPC exam practice questions. I am making this video because practicing questions is one of the best ways to prepare for the CPC exam. Before starting, don't forget to hit the like button, share this video and subscribe to my channel. First question, the spleen belongs to which organ system? Option A, endocrine. Option B, hemic and lymphatic. Option C, digestive. Option D, nervous. The right answer is option B. Spleen belongs to hemic and lymphatic system. It plays a crucial role in filtering blood, storing blood cells and supporting the immune system by producing white blood cells. Next question. Let us check the options first. Check option A, 99401. 99401 is for preventive medicine counseling or risk factor reduction intervention provided to an individual approximately 15 minutes. And option B, 99402 is for preventive medicine counseling or risk factor reduction intervention provided to an individual approximately 30 minutes. Option C, 99411 is for preventive medicine counseling or risk factor reduction interventions provided to individuals in a group setting approximately 30 minutes, and 99412 is for approximately 60 minutes. Let us read the question. A man at his annual physical is shown to have a BMI of 29.8. The physician provides counseling on risk factors for obesity for 10 minutes, which CPT code is reported. So here the physician provides counseling on risk factors for obesity for 10 minutes. Therefore, the appropriate code will be 99401, that is option A. 99401 is used for preventive medicine counseling and risk factor reduction interventions provided to an individual. So it applies to sessions lasting approximately 15 minutes and is used when a healthcare provider engages a patient in discussions aimed at promoting health and preventing disease. And in the question, the time is 10 minutes. Therefore, it exactly matches with the code 99401. Option C and D is wrong because it applies to group preventive medicine counseling, not individual counseling. According to the question, we have to code for individual counseling. Next question. Let us check the options first. Check option A, 20245. 20245 is for biopsy, bone, open, deep. For example, humeral shaft, ischium, femoral shaft. And option B, first code, 20225 is for biopsy of bone, trocar or needle, deep, example, vertebral body, femur. Now let us decide between these two codes, that is 20245 and 20225. Between these two codes, which is correct? In the question, they have given physician performed a deep needle biopsy of the femur. The trocar was visualized and guided using a CT scan and interpretation was provided. So here they have given deep needle bone biopsy of the femur. Therefore, the appropriate code will be 20225 because it is for biopsy of bone. They have mentioned needle and also it is for deep, example, vertebral body or femur. In the question, femur is given. Therefore, the appropriate code is 20225. Therefore, we'll eliminate option A and C, which has the code 20245. By checking the first code, we can eliminate the wrong options very fast. Now we are left with option B and option D. In option B, the code is 77012 and in option D, the code is 77021. 77012 is for computed tomography guidance, that is CT guidance for needle placement, example biopsy, aspiration, injection, localization device, radiological supervision and interpretation. And 77021 is for magnetic resonance imaging guidance for needle placement. In the question, they have mentioned CT scan, not MRI. Therefore, we'll eliminate option D. The right answer is option B. In this particular case, since the code 77012 already includes interpretation, there is no need to add modifier 26. The physician is performing both the imaging guidance and interpreting it. So the code itself covers everything needed. Next question. This question is from the ICD-10 guidelines. When coding procedure, how should certain conditions with an underlying etiology and multiple body system manifestations due to the underlying etiology be coded? For such conditions, the ICD-10-CM has a coding convention that requires the underlying condition be option A ignored, option B sequenced last if applicable, followed by the manifestation, option C sequenced first if applicable, followed by the manifestation, and option D none of the above. The right answer is option C. In ICD-10-CM coding, certain conditions have both underlying etiology and multiple body system manifestations due to that etiology. The coding convention requires that the underlying condition should be sequenced first, followed by the manifestation. When a disease causes other health problems in different parts of the body, then you must list the main disease first while coding. After that, you can list the conditions it causes. Next question. For this question also, we'll check the options first. Check option A. In option A and D, the first code is same, 91010. The code 91010 is for esophageal motility, manometric study of the esophagus or gastroesophageal junction, study with interpretation and report. And 91020 in option B is for gastric motility, manometric studies. And option C 91022 is for duodenal motility study. Let us read the question. Due to suspected gastric outlet obstruction, a manometric study is performed. Using nuclear medicine, the physician monitors the time it takes for food to move through the patient's stomach, the time it takes the patient's stomach to empty into the small intestine, and how fully it empties. What CPT code should be used? So, which among these three codes is correct? The correct code is 91020, which is in option B. Option A 91010 is wrong because it is for esophageal motility study, which measures how food moves through the esophagus. In the scenario, they have given gastric emptying. Therefore, this code will be wrong. And option C 91022 is for duodenal motility study, which assesses movement in the duodenum, that is the first part of the small intestine. But in the scenario, they have given tracking food movement into the small intestine. This code specifically focuses on duodenal contractions, not gastric emptying. Therefore, option C is also wrong. And the code 91013 in option D is for with stimulation or perfusion. It is an add-on code to be used with 91010. That option is also wrong. So that's it for today. Thanks for watching, and I will see you in the next video.